We need to shed light on the topic of men's mental health. When I speak to my patients, I often find that this dwells in the shadows because of stigmas and lack of open dialogue. And this then creates barriers for men to seek help from friends, family, healthcare professionals and support groups. Some of the most prevalent mental health conditions that affect men are as follows. Anxiety. This is often characterised by excessive worry and fear, among other symptoms. Anxiety tends to be unrecognised in men or denied by men who may resort to substance misuse or self-medication in order to try and cope. Substance abuse. Men tend to develop substance use disorders more frequently than women, and this may be because of the societal pressure surrounding masculinity and the use of substances for stress and emotional relief. Post-traumatic stress disorder, or PTSD. Whilst PTSD is more common in women than it is in men, 4% of men do suffer with PTSD, and this might be relating to traumatic occurrences like combat, physical assaults, accidents, all of which can elevate their vulnerability. Body dysmorphic disorder, BDD. In the UK, BDD presents a significant mental health challenge to men, with 2.2% of the male population suffering with this. It's characterised by an obsessive, appearance-related thought process that often leads to excessive grooming or preoccupation with perceived flaws. But the condition is frequently concealed in men because of social stigmas and misconceptions, which can then deter men from actually seeking the necessary help. Eating disorders. This is often misconceived as being exclusive to women, but men are affected too. It may present slightly differently in men, with some prioritising muscle gain, and that can also lead to taking performance-enhancing drugs. Obsessive compulsive disorder, OCD. OCD can present a unique challenge in men, with research suggesting that men often struggle to seek help because of stigmatised obsessions, perhaps violence or sexuality, which hinders their treatment-seeking behaviour. Depression. Depression is a prevalent mood disorder that triggers off symptoms of sadness, hopelessness, helplessness, disinterest in activities. And in men, they may also notice heightened irritability, anger, substance misuse. Depression is the UK's most prevalent mental health ailment and impacts approximately 1 in 8 men. I've seen the symptoms of depression have significant impacts on work, relationships, and overall well-being. And it's really alarming to know that men are less likely to seek help for depression than women, magnifying their susceptibility to suicide. Mental health issues transcend gender boundaries, with unresolved mental health issues being the primary cause of suicide in the UK and worldwide. But that being said, suicide does disproportionately affect men, with it being the primary cause for death in men under the age of 45 in the UK. Societal constructs of masculinity often obstruct help-seeking behaviours, and it's so pivotal to seek assistance from a healthcare professional for anyone experiencing such challenges. And this is where Movember comes into play. Movember is a global movement that aims to raise awareness of men's health and the challenges that they face. Their main work focuses on men's mental health, suicide prevention, as well as prostate cancer and testicular cancer. The Movember name comes from the idea of men growing moustaches during the month of November to spark conversations about men's health. There are a number of ways that you can help support the Movember movement. Number one, you can grow a moustache during the month of November and raise funds from friends and families. You can host or attend events like walks, runs or dinners to raise funds for Movember. Number three is you can donate directly to the Movember movement to support their cause. And number four, you can advocate, so use your social media, conversations and other channels to raise awareness of Movember. It's crucial to bring attention to the topic of men's health and the challenges that men might face. If you think you might be dealing with any of the issues that I've mentioned today, know that you're not alone and help is within reach. So please do reach out to your GP, a mental health specialist, or support groups, and know that your well-being does matter.